How do you manage recurrent UTIs with antibiotics? If you're dealing with frequent urinary tract infections, it can feel like a constant battle. Managing recurrent UTIs with antibiotics involves a careful balance of treatment, prevention, and monitoring. First, accurate diagnosis is key. Recurrent UTIs are usually defined as 2 or more infections in 6 months or 3 or more in a year. Your healthcare provider will likely order a urine culture to identify the bacteria causing the infection and determine which antibiotics will work best. This helps avoid unnecessary or ineffective treatments. For initial episodes, antibiotics are prescribed based on the most common pathogens and local resistance patterns. In complicated cases, especially in women, first-line antibiotics include nitrofurantoin, trimethoprim sulfamethoxazole, or fosfomycin. These are typically given for about 5 to 7 days. Shorter courses help reduce the risk of antibiotic resistance while still effectively clearing the infection. It's important to follow your doctor's instructions and finish the entire course of antibiotics. For people with frequent UTIs, low-dose antibiotic prophylaxis may be recommended after discussing the risks and benefits. This involves taking a small dose of antibiotics regularly, often at bedtime, to prevent future infections. Common choices include nitrofurantoin, trimethoprim, or trimethoprim sulfamethoxazole. Sometimes, antibiotics like cephalexin or fosfomycin are used intermittently every 10 days. Prophylaxis can be effective but should be limited to 6 to 12 months to minimize the risk of developing resistant bacteria. Regular follow-up is essential to monitor for side effects such as yeast infections, gastrointestinal issues, or resistance. In more complicated cases, such as those involving structural abnormalities, urinary stones, or catheter use, broader-spectrum antibiotics may be necessary. These might include fluoroquinolones, cephalosporins, or even carbapenems, especially if the infection is severe or resistant. Treatment duration can be longer, often 10 to 14 days, but recent evidence supports shorter courses if the patient improves quickly. Addressing underlying issues like obstructions or stones is also crucial to prevent future infections. Throughout treatment, antibiotic stewardship is vital. This means using antibiotics wisely, guided by culture results and local resistance data, to avoid unnecessary use and reduce the chance of resistance. Non-antibiotic measures like staying well hydrated, urinating frequently, and practicing good hygiene can also help prevent UTIs. In the context of bladder health and bladder cancer, it's especially important to be cautious with antibiotic use. Patients with bladder cancer, or those undergoing bladder procedures, may have altered infection risks. Careful monitoring and personalized treatment plans are necessary to avoid complications and protect bladder health. Always consult your healthcare provider for tailored advice, as managing recurrent UTIs involves individual factors and medical history. Following these guidelines helps ensure effective treatment while safeguarding antibiotic effectiveness for the future.